Now, as summer draws to a close and fall approaches, the United States is witnessing a spike in COVID-19 numbers. With new variants also coming out, people are reevaluating their risks of getting infected. However, how much should we actually be worried about the new COVID-19 variant, and should we be prepared for a new COVID wave? A highly mutated form of coronavirus has virologists concerned that threatens to be the most adept one yet and could slip past the body's immune defenses. Scientists are keeping an eye on the BA.2.86 lineage. It has 36 mutations that make it different from the currently dominant variant already. Experts have said that this particular variant requires intense monitoring and vigilance as well. It's because this new variant has a greater potential to escape the antibodies that protect people from getting sick, even if you've recently been infected or vaccinated. However, experts have also said that it's too soon to know whether it will cause more severe illness and how much should we actually be worried. For now, the Centers for Disease Control in the United States has said that its advice on protecting yourself from COVID remains the same. Vaccines are still the best protection against the new variants, specifically if it's been a while since you were last vaccinated. Here's a report.
COVID is on the rise again across America.
Over the past few weeks, we've definitely seen an uptick in the numbers of COVID.
New York saw a jump in weekly cases, up to 750 in August, compared to 250 the month before. It comes as health agencies try to keep track of a new, highly mutated lineage of the virus that causes COVID-19. So, should you be worried? One new variant of the disease that's raised concern among health professionals is called BA.2.86. So far, there have been only a handful of cases. And in short, experts say it's too soon to know whether it'll cause more severe illness. Reuters spoke with Dennis Nash, professor of epidemiology at City University of New York Graduate School of Public Health.
While we don't know all the details yet, what we do know does raise the possibility that this new variant could potentially evade current immunity to increase transmission, for example. And it could also potentially be of higher severity than variants that we've seen lately.
The Centers for Disease Control has said that the new variant could be more capable than older variants in causing infection in people who have previously had COVID-19 or who have received vaccines. In recent months, more cases have been attributed to Eris, a descendant of the Omicron lineage that originally emerged in November 2021. But doctors say patients with Eris aren't as sick as those they treated during the early days of COVID-19. Dr. Frederick Davis is the associate chair of the emergency department at Long Island Jewish Hospital.
They'll come in with body aches, maybe some fevers, and many times we're seeing patients that didn't even know they might have had some congestion and came in for totally unrelated symptoms and are found to have COVID.
According to data on the CDC website, U.S. emergency department visits and hospitalizations for COVID remain low, but have been rising since early July.
We are watching very closely what's happening. We do expect that there will be likely an even larger surge in community transmission as we move into the fall, right? The weather gets colder, kids are going back to school. And so we are looking at this closely with concern.
The CDC said its advice on protecting yourself from COVID remains the same. Doctors continue to suggest that vaccines are the best protection against the new variants, especially if it's been a while since you were last vaccinated. But the most effective new vaccines aren't yet available.
It will become available in the fall. I think that government should be doing everything they can to accelerate that timeline and get people vaccinated who are not yet up to date on their vaccines.
So this is a historical first. We have 3 vaccines available for the first time this fall to protect against 3 of the biggest respiratory illnesses. Hi, I'm Dr. Thomas Dzinski. I'm a professor in the Department of Epidemiology at the Richard M. Fairbanks School of Public Health at Indiana University. We are expecting all 3 of these viruses to be back this fall, with COVID-19 cases and hospitalizations already starting to increase. RSV, flu season generally start in September and can go into May. All 3 represent a serious risk of hospitalization, be admitted to the ICU, or even dying. especially among those with a compromised, immature, or weakened immune system. Hospitalizations for COVID-19 are already starting to increase in the U.S. In the U.S., for RSV, for example, between 58,000 and 80,000 hospitalizations among children less than 5 years of age, and 60 to 160 hospitalizations for adults 65 years and older. When it comes to influenza, we can expect somewhere between 140,000 to 700,000 hospitalizations for influenza. So all three of these combined can put a significant stress on our healthcare system. First, get vaccinated. As I said, there are 3 vaccines now available for the first time in history, but you need to get vaccinated early. You need time for your body to develop the immunity to these and provide the most protection possible. Second, if you are ill, stay home and contact your provider. For COVID-19 and influenza, there are treatments available, and the sooner you take them, the better chance of reducing symptoms and your ability to spread the disease. Third, wash your hands. Soap and water are the best, towel drying. That's an important message throughout the season. And then finally, avoid large gatherings indoors. However, if you have to attend, we recommend wearing a mask, especially if you're in those high-risk categories.